All right, we'll go ahead and get started. I know we have quite a few people still making their way in, and we'll continue to let them in. But since everyone is here, we'd like to say thank you for attending our very first webinar of this three-part webinar series. Before we begin, I do want to say a few things. So first of all, we will be discussing abuse and violence and some sensitive topics. So this is a trigger warning. If you ever feel the need to step out, feel free to end the call, to step out of the room, and feel free to join back in. There's no limit on how many times you can leave or come back. You don't need to turn on your video or unmute at any point. And if you'd like to rename yourself to a different name, feel free to do that as well. This is a very safe space. All of the individuals speaking here are professionals in their fields. And so if you do ever want to reach out to them individually, you certainly can after the call. And we will also be sending out a toolkit of sorts, which will have their contact information on it so that you can reach out if you'd like to. With that being said, my name is Mahtab, and I am a freshman at Rice University here in Houston, Texas, and I'm studying social policy and neuroscience. But I've been passionate about specifically raising awareness for teen dating violence for the past 3 or so years. And so that's where this webinar came from, and we hope that you enjoy. So I'll introduce our wonderful 3 speakers for today, beginning with Dr. Layla Contractor. So Dr. Layla Contractor is a board-certified child, adolescent, and adult psychiatrist, and she is the only certified integrative child, adolescent, and adult psychiatrist in Orange County, California. Our next speaker is Freyaz Shroff. Freyaz Shroff was born and raised in India and educated in America, has established Kurniv Foundation, a nonprofit organization focused on preparing students living primarily below the poverty line in education and mentorship. And finally, our third speaker is Shireen Mazdiasna. Shireen is an Iranian artist, a board-certified and registered licensed creative arts therapist. As a certified rape crisis counselor, she offers trauma therapy to survivors of crime and prolonged abuse. And so with that, we'd like to welcome all 3 of our speakers and you guys. And the format of this session will be a Q&A. We won't be sharing any screens, so you guys can see all of our speakers' lovely faces as they speak to you. And so we'll begin with the first question. How does abuse manifest itself in your careers? So what kind of abuse do you see? What ages, victims, survivors? Are people trying to leave, or have they already left? Who'd like to begin?
I can go first, and please cut me if I'm running too long. But I want to first give a kind of introduction to the setting I work with. My agency is funded by Office of Victim Services. So we're all grant-based, and we get referrals from law enforcement, from the hospital, and from different agencies in the community, people who have been either victims of crime or been close to being victimized. And that's how we get our referrals and people on our wait list. We have a wide range of people who are either dealing with a home that is very abusive. So it's either through Child Protective Services that we get those referrals. We also house forensic interviews. So if family, relative, or even professionals make a call about potential or possibility of abuse, sometimes as mandate reporters, sometimes as concerned citizen. We facilitate the forensic interviews so that the child and the law enforcement, the Child Protective Services, and different agencies can kind of talk with the child in a homey environment, in a trauma-informed setting. And so on our wait list, we get a range of people who have been abused and trying to get out of it, people who maybe think they're being abused, or sometimes we get referrals from agencies with a hint of, they're not yet acknowledging the situation, but there are traces or signs of abuse from the outside. So kind of keep an eye out. I think I'll stop there and I can add some things later if needed.
Thank you, Shireen. Freyaz, would you like to go next?
Sure. Thanks, Mahtab. So I made a few notes so I don't forget points, but abuse manifesting in career, I see it as anger or overworking. So let me explain what I see. I see it like somebody overworks so that they can overplease their boss. They can't say no. They're not taking care of their self-respect, their self-worth, or their personal relationships. They're sacrificing themselves at the expense of, they're working at the expense of themselves. So I see it manifesting in careers like this. So let's talk about then the ripple effect, right? I'm overworking myself, so I miss my son's baseball game. I miss my son's baseball game. It causes a problem in my marriage. It causes a problem in my marriage. I now then get more frustrated at work, but I can't say no to work, and I keep doing that. So when I don't know how to have healthy self-esteem, healthy boundaries, when I've grown up in a traumatic home, it manifests in the workplace in such instances. Does that help, Mahtab?
Yes, it does. So you're speaking about it from almost like a professional standpoint. So abuse can manifest itself almost like you're bringing the frustrations from work home, and that sort of manifests it in home.
Right.
Yeah.
Also, you misinterpret what your boss says. You say it, you take it in the lens of how you grew up, or when you are in a position of management, you might then be treating your employees as though you're that angry parent or that abusive parent, and instead of having a healthy conversation with the person. So abuse manifests its way into the workplace in many different shapes and forms.
Absolutely. Thank you. Dr. Contractor?
Hi. So I'm a child, adolescent, adult psychiatrist. Prior to being in private practice now, I actually worked for an HMO organization called Kaiser, and I was on their regional board for family violence prevention and child abuse prevention. So, I see kids and adults, and right, we have what everybody would recognize as physical abuse or sexual abuse that's just there. What I'm seeing more and more of in my private practice, in which would be considered a relatively affluent area, is neglect. And I think neglect is harder to pinpoint. You have immigrant families who are doing their best, right? Immigrant families who are really in survival mode, putting food on the table, wanting to send their kids to good schools, and yet their kids are grossly neglected. Oftentimes they may have other caregivers. And so what I see is, and what the research bears out, is that it isn't so much actually the immigrant population they do have trauma, who really bears the brunt of the trauma and shows symptoms of trauma is actually that first generation, arguably us, right? The people who are here. So I do see a lot of that. And again, it's hard to pinpoint because on the surface, it looks like everything is taken care of, right? Like you have a house, you have food, you're going to good schools, you have all these other things, but really what oftentimes is missing, and some of it's cultural, but parental attunement to like, what is it that kid needs? Other things I see is kids who are not diagnosed, right? They don't get the appropriate diagnosis. So the parents feel like they're doing everything that they can, and they are. But if you miss a diagnosis of autism or ADHD or severe depression, many of these things look like defiance. And in my, young adult patients, what I tend to see living in an affluent area like Southern California is the financial reality of leaving a difficult relationship is real. And in every socioeconomic side, whether you're a young adult, sharing an apartment with a partner, or you're a young adult who's living at home, continuing to receive abuse on multiple levels. And sometimes, again, this is also subtle. It can be more financial in nature. You just can't leave, or perceive that you can't leave. I've had patients who are actually even physicians. So many of the domestic violence shelters around here, you have to leave your job. So I've had physicians as patients who have had to leave their job. And of course, those are extreme situations, but now you're financially strapped and now you can't actually afford the legal coverage that you actually need to, protect yourself. So it becomes, unfortunately, a very difficult cycle. And the other thing I see is when young adults are emerging and there has been abuse in the family, whether it was neglect, whether it's financially, parents are keeping them tied down, or even, unfortunately, in the most severe cases, sexual abuse. And what I see is the person, I call it the canary in the coal mine, right? The person who has unfortunately been the victim of this terrible treatment, and I saw this actually even when I worked in East LA and in other areas, the victim is shown as the crazy person. There's something wrong with this. They got bipolar, they have lupus, anything and everything. And the family system maintains this whole form of abuse that's been going on likely for generations. And that becomes difficult, again, for multiple reasons, including financially. And I'd have to tell you, the last thing I want to say as a physician, what I see is to not downplay how much at risk some people are. So especially pregnant women. The number one cause in the US for death postpartum, meaning after a kid's been delivered, is homicide. This research came out when I was in medical school and it really shook the medical community. And that, unfortunately, stat has not changed. They were actually looking for, what type of infection is it? Is it hemorrhaging? And it isn't, it is homicide. I underline that because sometimes I feel like, and I guess we'll get more into that, so I don't want to go too much. We don't always know how dangerous it is for another person who is in a difficult relationship. And we might come well-meaning, guns a-blazing, but I think we'll talk about that more later, about how to support people in this type of situation.
100%. Thank you, Dr. Contractor. So actually, you touched on quite a few types of abuse. So when we speak about abuse, we usually think about 5 major groups. So we think about verbal or emotional abuse. We think about physical abuse, sexual abuse, the economic or financial abuse that you were discussing that can sort of lead into some type of legal abuse, and then finally digital abuse. So Shireen, I know you mentioned, so you're a rape therapist. Could you speak about the types of sexual violence cases that you see? How does that manifest itself? Is it usually in individuals who are older, who are living on their own, who are coming from lower socioeconomic classes?
So unfortunately, I would say there's no discrimination of classes or kind of education levels even. I would say, sadly, it's more kind of happening with children, and as opposed that thinking like there's a candy man in the van that might pose some risk for like as a stranger to children. It's oftentimes people in the household or people who have access in the household, people who are trusted by family members, people who are well and beloved in communities. They often have charismas that use different grooming techniques that, kind of prevails in a way of kind of isolating the child that they're targeting from their environment, from their parents, whether, oh, look, they're not caring, or, they're not doing this, they're not doing that, I'm here for you. And then using threats slowly of like, well, if you tell someone this is going to happen, if you tell someone your sister is going to be at danger, if you tell someone I'm going to die or someone's going to die. So that way, it's very sad that, and oftentimes, children, it's as these circumstances come together, it's very, very hard for children to disclose. So I work a lot with a variety of ages and different situations, whether disclosure was made shortly after, years or even decades after, or never there was disclosure, or there was never legal consequence for the offender. But again, years, decades later, they're coming to trauma therapy to seek kind of a way of being released from the burden that have been put on to them. Oftentimes, children take on the responsibility, being egocentric of, it's my fault, I did something, it's my fault, or I was a bad person, I'm not lovable, it was all my fault, or that person died, my fault. So that kind of often can trace through adulthood, and oftentimes finding yourself in different relationships that might not be working well or not kind of healthy, in a way of, well, if I'm the bad person, if everything is my fault, that kind of carries throughout your life. But it's not a life sentence. It's absolutely reversible with therapy or anything that you might find helpful. There are ways to kind of reverse those negative beliefs or those core beliefs that kind of lead up to making you decisions, to your daily behavior, daily habits, and all of that. So there's many, many wonderful modalities that, once a person acknowledges what they've been through and want help, want support, I would say there's a lot of resources, affordable, sometimes free. Our services are free to our clients. So Office of Victim Services, in every county, in every community, you can find ways to not only access free services, but also get compensation for different things that have come up because of the crimes or the assaults that have happened. So did I sidetrack from your question, or did I get the answer?
No, I think you answered the question quite well. So there's really no difference between who faces these types of abuse. We're all as equally likely to be abused and be in an abusive situation, unfortunately. And so I think that's why it's very, very important to know what it looks like, which is actually leading us to our next question. So my next question for you, my panelists, are what are some early warning signs of an unhealthy or an abusive relationship, especially for young people? So I want to give everybody a stat. Anywhere from 25 to about 65% of females alone will interpret an act of violence as an act of love. So we're seeing, the research shows us that many times young individuals don't even know that they're facing abuse. They think that the abuse is normal or even encouraged because they think it's a form of love. So Dr. Contractor, I'd like to extend the question to you first, since you deal with the child, the adolescents, and the adults, so what are some of the signs that you see early on in these types of relationships?
So one thing I want to highlight, Mahtab, that you so well said, is that from the outside, meaning us or anybody, if you're looking at a relationship that somebody else has, or we can look at that person and be like, how the hell do they not know this is a terrible situation? But most of the abuse is very insidious, meaning it's very slow. And unfortunately, most of these people already likely had some sort of history of abuse or neglect in their childhood to various levels, right? So we kind of have the inability to not see that it's dangerous. And I only say that because for people, when people looking on the outside, it seems like this would be so obvious, but this is also for yourself. If you have grown up a certain way, those things seem normal. And I'm going to give a very extreme example. There was this group of women who did a lot of advocacy work, and they were actually at Penn Nursing School, one of the best nursing programs in the country. And they gave their lecture, and at the end, one of the nursing students came up to them and said, "Do you mean it's not normal to be thrown down the stairs every day?" Again, sounds so extreme, but what your sense of normal becomes can really be very difficult because you have a family culture that's supporting this type of behavior. And again, not all of it is egregious, like being thrown down the stairs. But I think what I see are some of the first signs. So in kids or adolescents and young adults, isolation. So either they're being isolated by their partner, or they themselves are not feeling good enough So they're not going out. It may be for physical reasons, such as physical bruises, bumps, thing, or it just might be because they're starting to kind of go down the path of feeling kind of depressed. We see poor school performance. So you might have high achievers or then not doing so well, but in the workplace, you can see increased workplace absenteeism. And so they're not going to work as much. What I tend to see a lot more of is people like, oh, they're going to this naturopath or they're going to this heal, so we're starting to see medical also manifestations, fatigue, things like that. So medically speaking, those are some of the kind of first signs, the isolation. You can also see, like I said, a lot of irritability and anger, and worsening kind of performance overall, whether it's socially, at work, at school. Those will be some of the, I would say, earliest signs, and unfortunately kind of non-specific signs.
100%. So I think you mentioned it, but the fact that they're not specific actually probably doesn't help that individuals in those relationships don't recognize the signs when they're happening. You mentioned, the inability to go out as much. So sort of reminding me of what Freya's mentioned in the first question about lower self-esteem, not feeling as confident in yourself to speak up. Freya's, would you like to take the question next? Maybe build on that, or if there's something else that you observe in terms of early warning signs?
Yeah, sure. Thanks, Mahtab. So I want to talk about, I'm not a certified counselor, or Layla and Shireen are actually seeing the cases that come to them. I am seeing my students and what they talk to me about, and the signs that they might be missing, that I today realize from maybe mistakes I've made, that these are signs, such as the silent treatment. When there's something to be discussed, but they don't want to talk to you. They want to walk out. They want to ignore you having to deal with that issue with them. Second thing, when they know you're insecure about something, like when I was talking to you when we were preparing for this call, like pretend they know you're insecure about your nose, and now you're out to dinner with friends and they make a joke about your nose, and then they say, I'm just kidding. Why are you taking this so seriously? You can't even take a joke. Well, that's direct disrespect, right? They know you're insecure about it. They're going to make you more insecure about it. These are not the people who are your people. These are not the people you need to be hanging out with. If they want to break you down further rather than build you up, that's not your person. The third, if they are playing the victim, nobody likes me, my parents also don't like me, now you also don't want to be with me, this victim mentality that your partner brings to the table is a key red flag. So if they're ignoring you, they're intentionally hurting you, means they're intentionally doing things they know will cause you pain. And if they're playing the victim, these are your initial red flags. If you continue down the path with them, that's just going to get worse. Then it's going to become, don't wear that. And this is how it's going to sound, right, Mahtab? It's not going to sound like, don't wear that. It's going to sound like, baby, I want that to be just for me. Don't wear that shirt like that. That should be something special for me. It comes across as though they love you. And then that child or that young person interprets that, oh my gosh, they love me so much. But that's not it at all. That's the control. The victimness is then the isolation that Layla just spoke about. And then it just builds from there and gets worse and worse. And my favorite story to tell the young people, it's like, Layla and I've known each other since, oh my God, since we were kids. And I know that this is something we have talked about over the years as we became older and wiser. And I don't know how wise, but as we became older and wiser. But you think of a frog that you put in a pot of normal temperature water, and then you put it on the stove and you keep it on a very low simmer. By the time the water is at a boil and the frog wants to jump out, it's paralyzed. It can't. It hasn't recognized the signs. And it's up to us to have conversations like this, so young people on this call start recognizing the signs and knowing that they are on a slow simmer, and this is when they need to get out.
100%. It's a very powerful metaphor. I haven't thought of it like that, but it makes a lot of sense. I guess if you don't recognize the signs and then you become paralyzed, so to speak, then it becomes difficult, almost impossible to get out. You mentioned a lot about, things building up. So it's starting very small with statements and then turning into isolation and this victimization and then moving forward. And Shireen, I know you mentioned that you see individuals who have experienced abuse decades ago. So what does that building up look like? What are the early warning signs that they missed that then built up to lead them into an abusive situation that they haven't talked about in years?
Yeah, I think, the part of this isolation process, and also, at first you're hiding from other people for it's not a big deal, I'll just deal with it, right? And the more it progresses, the more you internally sometimes become shameful of this is happening to me, and it's so embarrassing that I have to hide and I have to hide and I have to go back, because if I've invested this much, like, let's see what comes out of it. I recently I'm aware to working with a client how during pregnancy also physical abuse is at one of the highest rates with women, which I think is very interesting from, talking about abortions and all this stuff. So it's there's this dynamic, and at some points it's not about you thinking back about orange flags or yellow flags, but it's really about becomes your survival. Like, how can you escape the circumstances without immediate risk to yourself, to your children, to your family members, to your parents, who you probably might have been cut off from over the years, or even sometimes from your own children. So I think at some points it becomes about your survival, and sometimes the only sadly result is waiting for the person to leave or die themselves, right? For you to have that exit. Because at times, depending on how much of a sometimes personality disorder we're dealing with, when it becomes over abuse and it becomes like this really extreme case of wanting to see your partner hurt and kind of torturing them in different ways, then you can't really have a choice until you are safe, whether by result of natural scenes and natural consequences, or maybe you have taken action. Maybe it has kind of got to your bone to make that decision. There's a recent movie I watched that I felt it really depicted nicely when you're in a relationship, and this was a it was a relationship between an affluent person and educated people. It's called It Ends With Us. And it's a really, really nice ways of using the movie and editing of showing how in her perception, right? Oh, I just fell down the stairs. Oh, I just slipped on the floor. And being able to go back when she was ready to see like, no, actually, I was pushed down the stairs, or I was pushed on the floor. And I'm not trying anymore to rationalize or kind of make sense of what happened and why it happened.
100%. Thank you. And I'm glad you brought that movie up. I think it's very useful for young individuals to see what abuse can manifest itself like in pop culture. I think that really helps us understand what it looks like. And so it's a very excellent movie recommendation. It Ends With Us. Our next question is about how communities, schools, and families can better support young people. So not only in recognizing and addressing the relationship violence, but also then exiting a relationship that is abusive. Freyas, I want to direct this question to you first, because I know you have this nonprofit that essentially creates a community for young individuals. So could you speak a bit more about that?
Yes. So community does become important, right? Where you have a shared set of values, where you know you're not going to be judged regardless of the decisions or the choices that you made, that you know you can come to this place for safety and security. But Mahtab, I want to touch on, I want to give an example, especially since we have parents here listening, families, teachers. We want to constantly reinforce for our young people that we are the safe place they need to come to. So I want to illustrate an example, real life example. I had a young student staying with me as she was building her career, and she was late coming home one day. And in her haste, she took a ride with somebody on a scooter to get here. Basically, several legal things were broken to get home on time, so that, you know, because she already knew she was late. Now that's an opportunity to have a conversation, right? Once emotions settle, once she's home, once she's safe, maybe the next morning we had a conversation. And my question to her was, if you got in trouble, if the cops stopped you, who would you call first? It was an opportunity to have a conversation, had nothing to do about abuse, nothing to do with anything else. It was an opportunity to reinforce this is the safe space. And when she said, I would call friend A, if friend A didn't answer, I would call Uncle B, means basically she had every answer but me. It was an opportunity to have a conversation to make her understand that, yes, I would be angry. Yes, there would be consequences for poor choices. But yes, I would be the safest option to get her out of that problem or trouble. Now, when you have these conversations repeatedly, then when they get really in trouble, they're like, okay, she's going to yell. Yes, there's going to be a consequence, but let me pick up the phone and call her. Right? I think families, teachers, mentors, friends need to constantly take opportunities to reinforce that they are the safe space, so that when the young person is really in trouble, they remember, oh, that's my safe space. Yes, bad A, B, C might happen with her, but that's not going to be as bad as E, D, E, F with somebody else, right? So, I mean, there's a very viral story going on just now in the United States about this Sudiksha Kunanki, right? I don't know if anybody's following her story, but I know I am, about this young 20-year-old student, pre-med student, who has gone missing in the Dominican Republic, and everybody is looking for her. Without commenting on any personal parental relationship, open dialogue repeatedly, knowing that there wouldn't be such bad negative consequences in different periods of time, may, and I don't know the situation completely, may have helped prevent what is happening now, right? I think what I'm trying to say is we need to keep the dialogue open with our young people as responsible adults. The more we keep the dialogue open, the more we get to have the conversation with them instead of somebody else.
100%. And I really like that you touched on the fact that the dialogue should happen after emotions have settled. So it's very difficult to have a productive conversation when both parties are frustrated or angry or emotional, one coming from a fear of getting in trouble, and then the other coming from a fear of what would have happened to the individual or a result. And so those are definitely difficult conversations. And Shireen, I know that you encounter these difficult conversations on a daily, and you actually help people work through these conversations as a licensed therapist. Could you speak more about how you see communities or families or even schools create those safe environments, those supportive environments, how you create a safe environment for the individuals you see?
Yeah, I think it's a lot of patience and time to let the person arrive to their conclusions on their own timing. I think it's never about, oh, this and this and that. Meh, 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 meh. Like you can't really project because as Dr. Contractor said before, you don't know what are their point of references, what is kind of what is their normal or normal-ish that, you know, is okay and what is really not okay. So if, let's say, at their childhood house, there was yelling, there was throwing things, there was just a lot of chaos and drugs and et cetera, someone who is just emotionally and financially abusing them is not really bad. It's not that they have to fear death every day. Yeah, it might be really annoying. It might be really frustrating to deal with emotional abuse and financial abuse, but it's doable instead of like fearing for your life, having to duck behind couches and under things because, oh, there's a flying glass, there's a flying vase. So I think being able to hold that in mind that, you know, people come to sessions when they're ready, and it might take years to acknowledge that, this is really not okay. Because, well, I'll leave this next part because I think there's a lot about cultural, you know, norms and values that play into this picture as well, about separation or about, you know, tolerance. So we can touch more upon that. I'll also add that part of our program and grants is going to the public school of our two counties and providing the different grades with healthy boundary curriculum. So talking about safe touch, talking about body parts, and you know, it's always you know, one of the days that you know, our facilitator, you know, they're trained in looking at kids' faces and just any signs of confusion or like, huh? Or just kind of freeze. You know, they're like, oh, why don't you go to the counselor's office, take some time there? And we get at times, you know, a lot of disclosure from those moments, like, oh, I was told this was okay, or I was told this is fine. I think in another aspect of schools, more so high schools, what has been become very prevalent is digital abuse and using the deep fake technology, or using, you know, your ex's face picture on different kind of pornographic videos or images, or even like sharing a picture or a video that's been of you maybe in a vulnerable state, maybe without clothes, or maybe just in a bad position. And that's another thing that's been really kind of, you know, accelerating in speed and in prevalency, which kind of taps into another form of abuse of exploitation and being threatened, monetary a lot of times for share, you know, you have to pay this much, like a ransom to for us not to share this with your class, or for us not to share this with that. And there are even like guidebooks in different countries about like how would you do this with children in America or teenagers in America. So it's becoming more and more the internet safety a big issue of exploitation.
100%. And I'm glad you mentioned, you know, the aspect of the importance of education and starting the education young. So here in Texas, actually, we recently had a bill passed. When I say recent, I mean in the last legislative session. So 2 years ago, Senate Bill 9 sort of mandated that every school include education about relationship violence at an appropriate level, but then caveated that with the fact that express parent permission was needed for every student to receive that education. And unfortunately, many public schools don't have the capacity or the resources to enforce that parent permission, and so just end up not providing that education. And so as an advocate for the past 3 years, I've been trying to go around to the schools in my district in the greater Houston area and a bit outside as well, and try to educate in high schools, especially in high schools, because that's when individuals are entering their first relationships, and we've run into a lot of legal tape there. So I'm really glad that you mentioned the importance of education and starting that education at a younger level. Dr. Contractor, would you like to add about how you've seen in your patients how they've received support from communities? So obviously they're coming to you for help, but how do you then tell the patients and maybe the patient's parents or the individuals who are bringing the patients to support them?
Yeah, so in my setting, it, can really vary. A lot of times, believe it or not, it's bringing to parents' attention that this is happening or has happened. That can be tricky. It's tricky if it's the actual abuse is perpetrated by parents. I get a lot of these, like, as I was mentioning, families who are very much about upholding a family image, especially in affluent areas, right? Like, and so this is like, oh, this can't get out. Like whatever it is, it can't get out. And it really puts the patient in a difficult. I see a lot of where this, sexual and physical abuse has been multi-generational. Parents were still confused as to why am I so worried about what's happened? Why can't she see the perpetrator? That abuse happened 10 years ago. It's done. She's over it. So I have to do a lot of, parent and family education around this. So don't underestimate how normalized the abuse happens. And like Freya says, it doesn't happen overnight. It can look like to you and us, like, this is so obvious. I can't believe. But again, in cultures where this has been normalized, like the example I gave of the woman who didn't realize that being thrown down the stairs every day was not like a healthy thing. I want to give some more general support of what I see that can be super helpful, because by the time you come to somebody like me, this is pretty like end game, right? Like, this is, if it's gotten this bad. One other thing I want to mention is also, I just remembered I had a case. It was actually a 9-year-old I saw this week. Bullying, the levels of post-traumatic stress disorder I see with bullying, and this 9-year-old had it. Very well-intentioned parents. It was like a girl in their community that they carpool with and they go to sports games with, but it was so severe. And unfortunately, the parents allowed it to happen because, oh, they're really good friends with the parents in this, but the girl was having full-blown PTSD symptoms. I think we can't, a lot of times we, even as friends or whatever, my blow, like, that's not a big deal, but everybody's different. Everyone's temperament's different. But this girl was really being physically bullied, emotionally bullied, kind of ostracized, and it was showing. So that's something, unfortunately, over the last 20 plus years of practicing, I see more and more real trauma symptoms from even bullying. And it can be, like Shireen said, which is digitally, that's horrifying, because it's not like you can do one stupid thing and it's forgotten anymore. It's like out there for people to remember in perpetuity. And especially for high schoolers, this can feel like death socially. So that's kind of, but what can you do as like the person that, like, Freya was saying, if you are then identified as the person, like somebody actually comes to you, the best thing you can really do is be non-judgmental. Like, this person doesn't need to say, oh my God, that's so effed up, I can't believe that. Again, that's our own response to how egregious something, or you just need to leave him and he's a piece of crap, or she's awful, I've told you this. Really, you just need to hear what they're saying, and that will be the most valuable. Most of the time, it's taken a lot of courage for anybody to tell anybody. And if you've been that chosen person, you should pat yourself on the back. That means you must have been safe in some way, shape, or form. But these people don't need any more judgment, because the judgments they have about themselves and the judgments their, alleged perpetrators have put on them, creates a lot of shame, feeling worthlessness. And as Shireen talked about earlier, especially with kids, adolescents and young adults, it's hard for us to see that adults have hurt us. We're hardwired to trust adults and when we need adults physically, emotionally. So we will turn it on ourselves that we are no good for this happening to us. So if somebody has come to you, the best thing you can do is be non-judgmental and really validate kind of what their experience is. When I say validate, I mean like, this sounds really hard. I'm so glad you came to talk to me. I also want to remind that if you do know somebody who is in a violent relationship or somebody that's in a relationship that's abusive in any way, shape, or form, it's important to remember the stat that it takes at least 7 times before somebody will actually leave a relationship. And you actually never know how dangerous that relationship really is. And that's why I gave that stat about homicide being the number one cause of death postpartum. So, you know, all well-intentioned, you feel like you can muscle this, but I will take you out of this abusive relationship. I'll do this, I'll do that. You don't know what type of danger you're putting them in. Sometimes the best thing you can do is just being their point person. You may get very frustrated if they leave and go back and leave. This is unfortunately part of this cycle. So what you can do is often give them numbers that they can store under another name, right? Right. Because oftentimes these people are also being monitored in some way, shape, or form. Recently, I had one that was video cameras all over the house. It isn't always as obvious as that, but sometimes they have GPS on their phone. So whatever you can do to give them numbers of, you know, domestic violence shelters, different things, whatever you have in your area can be, but do not underestimate that you might be putting that well-meaning as you are, putting them at risk. So really being non-judgmental, validating how hard it is, continuing to be that open person, getting support yourself, because this can be, especially given what the relationship might be, it might be really hard for yourself. So get support from somebody like Shireen. You know, Friaz is downplaying her experience, but Friaz used to work in a sexual assault place where she was a counselor for sexual assault. So she has a lot of experience. Again, giving them the resources so when they are ready. And sometimes these people also, you know, a lot of times domestic violence shelters will even have lists of like, what are the top 10 things you need? Anyways, I just say that. So the non-judgmental validation, knowing that this isn't going to happen overnight. It didn't happen overnight and they're not going to leave overnight. And there's multiple factors to this that you may not understand. And then getting support for yourself or getting professionals involved who know how to deal with this. Because if you're not in the field, it can be hard. You know, you wouldn't perform surgery if you've never done surgery. This is kind of a type of surgery, honestly, extricating somebody from a very difficult, either family or even intimate relationship.
Thank you for that. I'm really glad you outlined some of the things that we can do if someone ever does reach out to us. I think it's very important that you mentioned that most of the time we can't do anything except listen. And it's difficult for us as individuals who are hearing about these things, especially if it's coming from someone we care about. But it does take 7 to 10 times to actually fully leave the relationship. And actually 50% of individuals who are abused end up either choosing another abusive relationship or even becoming an abuser because they think that's the only way they can leave sort of being the abused is to be an abuser. And so it's very important to keep these numbers in mind for us as individuals because we can't help any more than a surgeon who hasn't been trained can perform surgery. So with that, I'd like to put a toolkit in the chat. And this is a toolkit that has been comprised over a few years with resources for everybody. It includes creating policies in school districts, but also a lot of resources that our speakers have actually compiled. So there are websites on there like Love is Respect and some from the NIH that sort of outline what abuse looks like, how to help, all of these things that our speakers have talked about and more. So that's in a centralized place. Feel free to share it with anyone. You don't need to sign in. It's accessible to whomever would like to click on the link. And with that, I'd like to open the floor to our audience members if we have any questions or comments for our speakers. I'd also like to invite our speakers to put their contact information in the chat if anybody would like to reach out to them. If you guys would like to do that.
Mahtab, can I just add a little bit to what Layla said? Because I think it's super important that she mentioned that someone in an abusive relationship goes back approximately 7 times before they step out of it. And thank you, Layla, for mentioning that I did counseling. So I worked at a high-risk shelter for domestic violence victims, and my clients were 21 years or younger, just to put it in perspective, right? And the number one thing they would say why they would go back, because the known evil was better than the unknown evil. So they knew, they would say things to me like, well, I now know if I say this, he will get angry. Or if I don't have this done, then he will push me down the stairs, etc. But I don't know what it'll be like to get an apartment of my own, to raise that child on my own. I don't know. So the unknown keeps them in the known. And I think that's where professionals like Shireen and Layla come into play, because they help you see and walk through the various situations that are unknown. Would you agree with that, Layla?
Thanks for highlighting that. And I want to tell you that happens at a nervous system level. We are the unknown that it is better becomes scary. And you actually have a lot of fear around that. And that fear can be mistaken for being unsafe. I'll give you extreme examples. Even women and men who've been trafficked into prostitution, a high number of those, once they have been rescued, will return. I'm giving you extreme examples how even with so much abuse, you go back, and that is at a nervous system level that your body actually does not feel safe in the safer environment. You tend to be wired like to the known evil.
Yeah.
So that's 100% correct. And I want to tell you again, it happens at a nervous system level. It isn't just somebody being willful.
And something else I remember, Layla, is something I remember when I was younger and I was doing this work is abuse predominantly starts when a woman is pregnant with their first child. Like when the closeness and the trust and the respect is so deep, and then that fear or that trigger or whatever kicks in for the person who is doing the abuse. Am I remembering this correctly, or am I misstating something, Shireen or Layla? Am I misstating something?
I think there's truth to that. Yeah.
Yeah. I somehow remember, a lot of the young people or the young women who were coming, it would start once they were already in quote unquote healthy relationships, but those red flags we talked about way in the beginning. And then once they knew that girl was theirs is when things began to escalate. So it's very important to remember abuse is not one size or one package for everybody. And sometimes it comes out of the blue to the person being abused. Like, hey, we were in this quote unquote healthy relationship. He cared about what I wore. He cared about, keeping me safe by keeping me away from everybody else. And now what is this happening? So when you miss the smaller red flags, they turn into the bigger ones. And I echo the sentiments as a young woman who has made a poor choice in relationships. And I will tell you, I echo Layla's sentiment of don't stand in judgment, because had my parents stood in judgment of me, I don't think I would have walked out the way I did. Had they not listened again and again and again and again, I would have maybe continued to make unhealthy choices. So it's important to listen without judgment. It's also important to be the parent that the child feels comfortable talking to again and again and again without ramification. Adults play a crucial role here, crucial role. Thanks for letting me say that.
Thank you, Freyaz. And actually, we had a comment in the chat from Dr. Arauz. They said, thank you for an excellent, insightful panel. One thing that has maybe not been touched on is when children are abused by a sibling or their parent, their greatest fear will be not only how do I talk about these unheard of happenings, but also no one will believe me and I will be punished. So I believe mothers and those caring for or teaching or befriending children should reassure the child that they are good children and that you will believe and trust their word and keep confidence. So again, touching on that point that be a safe space, be a non-judgmental safe space. Thank you for that.
I want to say one other thing. I've multiple times seen people, like, when somebody finally comes to you and says, I've been physically abused, sexual, whatever the abuse is, and their friend is like, are you sure? That is like, I want to underscore, and I'm sure all of you are here because you're not like that. I want to underscore that you might have been like the only person this person would ever tell. And again, this is where the validation is really important. I mean, I cringed when I heard those stories of people like, if somebody is telling you, trust, it took them a long time to come out and tell anybody. So again, it comes back to the non-judgmental piece.
Yeah, and I'll add shortly that there are some also, cultural signifiers, even like on a college campus. There are cultural cues and like conversations and like trendy behavior, right? So if it happens, we know a lot for freshmen to be sexually assaulted in their first year on campus. And making sure that you can be that one person out of maybe a group of people laughing and like, oh, she got a good laugh, like making fun about the sounds maybe they heard or the things that they figured, put two and two together. Make sure you check in with people because you never know what's really has happened, and that person maybe just don't have the voice or the courage to think and say, well, that was really wrong. I didn't want that. Because if everybody's saying, oh, you had some fun last night and da da da, then it's really hard to kind of acknowledge that for yourself.
Yeah, and I'm really glad, Shireen, you mentioned the part about it happening on college campuses. Actually, at Rice University, we have this mandated class that we have to take called Critical Thinking and Sexuality, which is about interpersonal violence. And they spent an entire week speaking about what is called the red zone. And the red zone is the time from when you begin the semester to about Thanksgiving break, where 50% of all college assaults happen. And so it's within 2 months that 50%, half of all sexual violence assaults that happen to college students occur. And it's because they're not in a safe space. They're leaving the environment that they've known for their entire life for the very first time. And so I think it's really important to address that because it just shows us the need for having a safe environment, a non-judgmental environment to go back to. Thank you for that. To our audience members, do we have any questions or comments? Thank you, Shireen, for putting your contact information. Freya's our contractor, if you guys could put your contact information as well, that would be much appreciated. I know we're at the end of our time, at the end of our hour, so I don't want to take up any more of your time. If you have to go, no worries, but we will stay back just a bit longer if you have any questions and for you to note down the contact information of our panelists. Thank you for joining, and please do join our next webinar. So this is the first in 3 webinars, and the next one will be on April 5th at the same time, and we look forward to seeing you there.
Hey, Mahtab, can we say a few thank yous? Like, thank you to you as a young person for seeing this need and organizing this this seminar. So thank you for giving Layla and me an opportunity to reconnect as adults on this platform, inspiring young people when we've been through some very tough childhood things together, including relationships. Thank you for introducing Shireen to us. It has been amazing to learn from her. And above all, I want to say thank you to FEZANA, because I know that I have what I have in part because of mentors like Hoshi Mehta and Hutakshi Contractor, and those older mentors that took us under their wings and became our safe spaces for us to go to and us to talk to. And now, Mahtab, I know Hoshi Uncle is one of the supporters that allowed supported you on this platform. So it's important to acknowledge that we have grown up with FEZANA from 15 to 50, right? And we are thankful for FEZANA being that place we can keep going back to and say, hey, this is where I am. This is where I'm stuck. This is where my mental health is. And I think this is what allows us to create the platforms we do for the young people we serve and we work with. So thank you, Mahtab, for providing this platform. Thank you, Hoshi Uncle, I see you. And thank you, FEZANA. And thank you to all my kids. I see quite a few of you on here. Happy to see you.
Thank you. We actually did receive a question in the chat. So it came to me directly. And the question is, how does one deal with abuse from a family member?
That's a hard question in a sense that, I think it's something you have to really reflect upon your family values, your personal values. But also, we do live in the West. I was born and raised in Iran, so I think that's where the complexity comes, and it's very individualized quest. But I think being able to realize what is important for you and how you would like to be respected or treated, and what are some ways that you can create that for yourself, whether you're a hopefully older child or a young adult, to kind of figure out how could you tolerate or be okay with maybe smaller portions of interactions, or maybe figuring out what would be an okay dose for you in a way.
I would say also, to piggyback off of Shireen, it also depends on what type of abuse we're talking about. I also want to underscore, and it's something that we talk a lot about physical abuse or sexual abuse, but when you talk to victims of domestic violence, they will tell you the worst abuse they incurred was actually the emotional abuse, the insults, so I really want to underscore that, because that tends to be what the majority of people actually undergo, is kind of emotional abuse. And I would have to say the kind of silent epidemic of neglect, which is you never know what you never had. And that's why neglect can be a little bit tricky to even kind of diagnose. Again, so I don't know what type of abuse, unfortunately, they might be facing, or somebody that they know. But I would also ask to turn to kind of a mental health professional to see how can they help you navigate through this, and how can they objectively mirror back to you what it is that you need. And of course, if there is really severe abuse, going to mental health professional to help you navigate that process is really helpful. So unfortunately, I don't know the type of abuse this individual's facing, but there is some that's just not acceptable, and it's not just sort of small boundaries.
I think it's important for a young person who is unsafe in their home to find a safe adult. You got to keep telling an adult, if you're a minor, you got to keep talking till you find a safe adult. And then let that safe adult handle it responsibly with whatever future steps need to happen. If you're a minor and you cannot get out of the home and you're facing that kind of abuse. If you are now an adult, acknowledging that abuse and finding the right mental health help you need is what you need to do. You cannot spend the rest of your life saying you're making poor choices because of what your mom did, or what your dad did, or what your mom didn't do, or what your dad didn't do. There has to come a point in life where you take responsibility for your success, your mental health, and you go and get the help that you need. And then you make the difficult choices you need to make, whether you're going to keep a relationship with them, whether you're going to step away from a relationship with them. But there comes a point as an adult, you got to take care of yourself, and you cannot live as a victim, and you cannot keep blaming everybody else. But if you're a minor, you don't have to live with that, and you need to keep talking till you find a safe adult. That safe adult can look like a neighbor. That safe adult can look like a teacher. That safe adult can look like a grandparent, can look like a friend's parent. but you got to keep talking till you find a safe adult. And I think that's an important message to give to our young people. You are not alone in what you are going through. You are not the first person to go through what you're going through. There is another woman or another young man who has been through what you are going through. You will be surprised when you talk how much more support is out there for you than not. So keep the conversation open, keep talking. Don't assume nobody cares, because there are people who care.
And
Thank you.
I will add one more thing, kind of, that it's, you know, part of the reason a mental health professional can really help is that there is so much complexity and confusion about someone in a role that are caring for you, are providing for you. And I mean, I don't think I know a child who doesn't love their caretakers or parents. At the same time, if there's abuse, if there's disrespect, intrusions, invasions, you still doesn't kind of question the love. So holding both of these can be extremely challenging and confusing and self-dissolving in a way. But know that there are skills to learn that you can accept both of these and come to peace that yes, there was good parts, there is love, there is care, but also there are other things that maybe as an adult or as a young adult, you can look back and say, not for me, or you know, I wouldn't do it this way. But you can kind of get that shift in that perspective from a bit of distance, from being able to have that safety and that kind of space to look back and say, okay, this is what it's like, or this is what it could have been like, or right, but taking that responsibility.
Thank you. Another question we received is, how does one navigate and address emotional abuse occurring in the family when they are already considered a rebel child?
How old is the child? How old is the rebel, so to speak?
I'm not
Rebel-
sure.
Is the rebel a minor, or is the rebel above 21? I have things to say, Mahtab.
Well, I'm not sure. If this individual would like to directly message me the age that they are discussing about, I welcome it. But let's address both. 21 now.
21. Layla, you want to start, and then I'll piggyback off you?
I believe Shireen would have great things to say as well. I think this is an ongoing journey. I know it sounds maybe self-serving because I'm in the mental health field, but I still say finding a therapist who can help you, finding a therapist who is actually trained in trauma work can be helpful as a young adult. And this takes time, right, Shireen? I think something we haven't talked enough about is cultural input. All of us, you know, have a foot in two different cultures, sometimes even three, right? And so having somebody to help you now, but really it comes with being able to stand in yourself, but getting the help for that. You know, even as somebody who's in the mental health field, I see a therapist twice a week. I mean, trauma is one of my specialty areas. People come see me. I have to make sure I take care of myself so I can be there for my patients. But this is an ongoing journey, but really taking good care of yourself. You know, Shireen talked about this early on. Really, I mean, I know it sounds like overplayed, but it comes around boundaries. And you have to become more and more comfortable with the uncomfortable, right? The uncomfortableness about, and I talked about this earlier, like you're often the canary in the coal mine, meaning, I don't know if anybody knows that analogy with these two canaries in a coal mine. And if a canary got sick, that meant that there was some nauseous gas, you know, there was a gas in there that was going to kill everyone else and everyone else. But you are typically the one who's changing the pattern for this family. You're the one calling out the bullshit. You know? And so having better boundaries, understanding that taking care of yourself and having boundaries and not accepting behavior. But this is a process because we are especially culturally, there is a lot what we call enmeshment, right? Like families that are into each other's business, that's culturally very much validated. And I believe I can speak for the Iranian culture too, Iranian Indian culture. This is part of the gift and the curse of these cultures, right? People are there for you in tough times, but also, so it is really a process, but you do not have to take it alone. But I would get a mental health professional who's really going to help you walk this line and learn how to do it, because none of us are born with the roadmap of how to do this.
Shireen, you want to add to that?
Sure, I can add a little about the trauma therapy piece, and you know, it might sound different to different people. I will say that I would like to think of it as it's kind of a time traveling system. So oftentimes I don't offer trauma therapy to people who are either in a traumatic situation or just recently are or removing or already have removed themselves from the situation. What we're looking for is safety at home. So you can go home and feel safe, or if you're logging on from home, you can feel safe. You can look around and assure your nervous system, I'm okay, I'm safe, no need to be in fight or flight or freeze. And those are things you learn, you know, with your practitioner, to how to go from fight or flight to rest and digest. How do you kind of keep going back and forth? And that kind of adds on to a skill of staying within a place we call window of tolerance, to be able to optimally think, to be able to be problem solving, to have creative solutions, to ask for support, to look for resources, right? When you're in that really kind of jagged nervous system, when it's like life or death, it's a crisis, even if it's not. Maybe there was like a sound of a stone on your window and you're suddenly like, don't know what to do, or you're freezing, right? So going back to the time traveling system is that, you know, each session of trauma therapy in a way is you're getting together in this kind of time capsule, and you're going to different parts of your past and you're reprocessing. So there are different modalities that you can do. Creative arts therapy is one of my main modality, and I also do EMDR, which is just incredibly magically scientific, is the way I put it, because you're pairing a calm nervous system with working through those core beliefs that were shaped. And then you come back in the present moment, and then on to your life you go, and taking care of yourself during the week, and then come back next week. So, you know, it's something that you kind of have to plan for, the trauma piece of it, because it requires stability, because it can be destabilizing in many different ways.
Mahtab, I would just say, if you're 21 years old and you have the ability to create distance from your family, then do. In that, if you have the ability to live separately from them, then do that. Whatever you need to do to create that distance. Do you need to cut off from your family? Again, that is up to you and your counselor, or up to you to determine how much they're rocking your world with the emotional and verbal abuse. But if you're 21 and you can create space, then create space. Second, determine your boundaries. Be clear to communicate those boundaries, and be clear to understand what the consequences are if those boundaries get crossed. And then exercise those consequences. If you need to learn how to set boundaries and how to exercise consequences, then avail of services like Shireen and Layla offer, or look for free resources if you can't afford very expensive mental health professionals. But learn, you know, in today's world, emotional abuse, verbal abuse, it has found a common place. I live and work in India. This happens in places of work. This happens in homes. This happens just on the street. And knowing and learning how to create distance from it, and how to have boundaries, exercise those boundaries, become key life skills that you need as a young person today to navigate your future. And if you can't learn these skills at an early age, you struggle and suffer as an adult. Because I see it in our Parsi homes. I see it. I see how even today, people my parents' age will deal with that friend or deal with that relative because we're Parsi and we're Indian and that's what we do. And they're welcome in our home, even if that person is abusive to us, even though we know it is not healthy for us to be around that person. So I think these are core life skills our younger generation needs to learn. And at 21, whoever gave that question, here is my loving advice to you as a 50-year-old. 1, create distance if you can. 2, don't walk away from mom and dad. Having a key relationship with your parents is very important to your growth and success. Understand and learn how to establish your boundaries. Build the consequences, even if they're mom and dad. Have the conversations repeatedly. If you are being hurt and offended, then say it repeatedly. There's also a lot of gaslighting that goes on in our Indian households. Oh, come on, you're being too dramatic. Oh, that's not what it is. It's not dramatic. You can't receive it. That's not my problem. But I'm going to say it again and again until you understand that that is hurtful. Don't say it. That is hurtful. Don't do it. But say it respectfully. Don't degrade your parents. Don't degrade your adults. Build healthy relationships with them. It will serve you well going forward.
I do want to say that, and this is also cultural, just again, as much as possible, you want to maintain a relationship with parents or whatever family member. But there is a point where the abusiveness, and if they're truly not willing to change their behavior, then we sometimes have to make those really painful decisions. And that's where seeking the help of a mental health professional to help you do that. I think too much culturally we allow abuse because it is an elder person. It is an older, oh no, that's, and I've seen that play out quite a bit. Oftentimes in making that really hard line, the person may or may not come back and realize that, oh, you were serious. Again, I'm not saying, but I think as Freyas is saying, that shouldn't be necessarily the first option unless, of course, the abuse is pretty, and in some cases, unfortunately, in our own culture, it's quite egregious.
So in some of the, or in dialectical behavior therapy, there's a skill called radical acceptance, which kind of gives you different ways of looking at things that you want to change, but also accept. And you might ask, well, if I'm accepting something, why would I want to change it? And it's like, well, they come kind of hand in hand. That's kind of part of that paradox. And I think it's always worthy to say that abuse, especially when it passes just maybe disrespect, is never to be radically or non-radically accepted. It's always, it's not to be deserved. It's not okay. And I think even if it's a loved one, you have to find the kind of whatever that makes sense for you to find yourself and your respect and your value back from the situation. So I wanted to add that.
Thank you. Okay, so if we don't have any more questions, we do have just a comment in the chat. I don't want to sound ungrateful since the topic of parents are concerned. I do feel they're being a burden on me at times, and that comes in the middle of my focus. So any suggestions on how to, I know there is a lot of discussion about having repeated but respectful conversations. Any suggestions on how to, I mean, I would think that distance is sort of the answer here. Any comments on this comment?
I think what I'm hearing is having some borders that you yourself have to stick to, or create a space that you can stick to. So it sounds like if you're focusing on things, if you're working or working on some projects, you need to dedicate a time and space that nobody can access you, including your parents. And I think at times we are usually the ones ourselves who, oh, let me take this, or oh, what if they really need me, right? But I feel like healthy boundaries come with a bit of a kind of decisive and not rigid, but a commitment to, okay, this is my time and space to focus on.
I think, Mahtab, for me, I will say the greatest gift I have received is building the relationship I have with my parents and that they have built with me. It's a two-way street. They do what they know to do based on what they know. We know because we have access to something else. And I think if the situation is not extreme, like Layla and Shireen have mentioned, and if it is a workable situation, I think you need to have the conversations with your parents. And I think it is well worth the effort to build that relationship with your parents. It's the kindest gift you can give to yourself if the situation is not extreme. Because what I have learned is they become your entire world, your safe space, your confidants, your friends. They are the people that, yes, there will be consequences for your poor choices, but they will also help you through whatever you've got yourself into. If the situation is not extreme, then figure out how you can talk to your parents and build the relationship with them. If the situation is extreme, then definitely seek the assistance that you need.
Thank you. All right. And with that, we'll conclude our first session of our three-part webinar series. Thank you to our speakers, Shireen, Freyaz, Dr. Contractor, for joining us for 1.5 hours out of your very busy lives. We truly appreciate it. And we thank all the audience members for also attending. And we invite you to our next session, which will be on April 5th at the same time. And that one will be about actual experiences that individuals have had in the community and working through those. Thank you all.